Medicare versus Medicaid. Key differences every retiree must know. Baby boomer wealth builders, have you ever felt unsure about the differences between Medicare and Medicaid? You are not alone. So many retirees share the same uncertainty. Now, in this video, I'm going to break it down for you in simple terms and share insights most people miss. And here's the best part. By the time we're done, you won't just know the answer. You're going to feel steady, equipped, and confident about your next steps for your health, your finances, and your legacy. So let's get started. What are they? Medicare and Medicaid are not the same. And understanding that is your first win today. Medicare is a federally funded program. And if you are enrolled in Original Medicare Parts A and Part B, the benefits and rules are the same throughout the United States. That means your core hospital and medical coverage works anywhere in the United States as long as you see providers that accepts Medicare. However, Medicare Advantage plans, Part C, Part D prescription drug plans, and the Medigap supplement policies can vary depending on where you live and the companies that serve your area. Now, Medicaid, on the other hand, is a state administered program. Each state decides who qualifies, what's covered, and how the program is ran. Now, the simplest way to remember, Original Medicare is nationwide coverage. Medicaid is administered by the state that you live in. Now, when you understand this difference, everything starts to click. Now, who gets what? Original Medicare, the eligibility is straightforward. You qualify at age 65, or if you meet specific disability criteria at an earlier age, you can also get Medicare. And most people have paid into Medicare through their payroll taxes. Now, Medicaid's eligibility, it depends on your current income, your assets, and not your age. Now, here's where it's critical to be precise. Each state sets its own financial limits, and those can change every single year. Now, in our baby boomer wealth builders community, I prioritize providing you with verified information specific to Texas, where we live. And I can ensure all the decisions are based on accurate facts, not assumptions. Now, you may also want to check with your state to find out the criteria necessary for your available benefits. Okay? Coverage differences. Original Medicare has two main parts. Part A, hospital coverage. Part B, medical coverage for doctor visits, outpatient services, preventive care. Now, many people add a Part D prescription drug coverage, but there are limits to Original Medicare. Generally does not cover long-term care, routine dental, vision, and hearing. Now, or even eyeglasses. Now, Medicaid, depending on your state, it may fill in some of those gaps, including the long-term care, nursing home care, in-home support, and sometimes even vision and dental benefits. Knowing which program covers what is how you avoid gaps in your care and unexpected costs. Now, state differences. Medicaid is managed by each state, so two retirees with the same income can have different benefits based on where they live. State variations. Some states have expanded Medicaid to help more people, while others have stricter limits. And rules change all the time. Medicaid rules can change over time. What applies now may not apply in a few years. Now, that's why it's important for you to check with your state's official Medicaid information before making any decisions about your coverage or your eligibility. Now, they have something that's called a spend down strategy. Now, if your income is above your Medicaid state limit, you might still qualify using what they call a spend down strategy. It's available in some states, not all states. Now, here's how it works. So you subtract your medical expenses. You can deduct approved medical expenses from your income. Check with your adjusted income. So you just check your adjusted income, whatever it is. So if the deduction brings your income below the state limit, you may still qualify for Medicaid, okay? For example, state limit could be $1,000 a month. Your income could be $1,200 a month. That's a $300 qualifying medical expense. So the adjusted income, $1,200 minus $300 equals $900, and that qualifies you for that spend down program. So remember, these rules vary state by state. So check how it works in your state, okay? And then there's another one, dual eligibility. Now, dual eligibility means that you have both Medicaid and Medicare. Medicare would be your primary coverage. It pays first. Medicaid is your secondary coverage. It covers your Medicare premiums, deductibles, and sometimes some additional services. But for most people that qualify for this combination, they can provide more coverage with lowering your out-of-pocket costs. But the Medicaid part always depends on meeting your state's eligibility rules. I hope that's clear. So let's clear up some myths. Here are 3 common myths I'm going to clear up today. Myth number 1, Medicare covers long-term nursing home care. Truth, no, it does not. Medicaid may cover it if you meet your state's requirement. Myth number 2, Medicaid will take your home while you're alive. I've heard that a lot. Your home is usually safe as long as you're living in it, but some states may recover costs after you pass away. Now, that's the truth. Now, myth number 3, you can choose between Medicare and Medicaid. No, you cannot. Medicare is for those who are older, 65 or older, or the disabled, while Medicaid is for those who have a financial need. Faith and wisdom. Proverbs chapter 4 verse 7 says, wisdom is the principal thing. Therefore, get wisdom, and with all that getting, get understanding. Understanding these programs isn't just about avoiding mistakes. It is about positioning yourself and placing yourself in a position to win, to make wise decisions to cover your health, your income, and legacy building for your family. Your next step is to download my free Retire Flow Guide. It's a step-by-step plan for you protecting your health and wealth during your retirement. The link is below the video. In our Baby Boomer Wealth Builders community, I go above and beyond. I do my best to help you, empower you with anything that you need. And if you have any questions or concerns, if you contact me, DM me, I will get back with you, follow up within 24 to 48 hours. So now, if you have not already subscribed to my YouTube channel, hit the subscription button and drop a comment below about your understanding now after the video of Medicare and Medicaid. Now, let's walk in wisdom, protect what we've built together, leave a legacy worth remembering together. Blessings.